access for those in and outside of District 8. Scott, I'll let you go with this one.
We have to make sure that Healthy San Francisco stays strong. I supported it when it was enacted. I continue to support it. It's not perfect, but it gives access to health services to a lot of people who wouldn't have it otherwise, and we have to keep maintaining that. We'll see how what happens when the federal healthcare law goes into full effect. I think that's in 2014, but we need to make sure that we are staying strong with Healthy San Francisco. We also need to make sure that we are keeping our core public health system strong, which is extremely challenging in these budget times, and I'm not going to be Pollyanna about it. When it comes to things like mental health services and substance abuse treatment and treatment for people living with HIV/AIDS, we need to, again, in terms of priorities in the budget process, those will always be priorities for me.
Number one, we have to make sure that the feds are keeping Medi-Cal and Medicare intact, because that's going to be critical when you're talking about keeping your baseline services that San Francisco is so famous for that we provide. Number two, we've got to make sure that we're fighting for all the HIV/AIDS, hepatitis C, hepatitis B, all the diseases that are rearing their ugly heads every day in the city. We need to make sure that we are fighting and making sure that we're protecting that funding so that we limit that. I'm proud to have the endorsement of the President of the Health Commission, and I look forward to working with the new Department of Public Health Director, Barbara Garcia, when she's enacted.
Bill?
Yeah. Healthcare obviously is critical. National healthcare is amazing that it was passed. I love that. But Healthy San Francisco, big advocate of it. I think it could be done better. I think there's some waste in there that we can look at. The numbers just don't add up for me, especially for some small businesses, of how they're taxed on this and how they pay. So yeah, it'd be a priority for me.
Rafael?
Well, we're already cutting funding for critical public health services at San Francisco General and our community health clinics. We've closed mental health facilities over the last year. So a priority for me has been, and I have done a lot of work around trying to protect funding for those institutions. With regard to our private healthcare system, we need to be pushing our private healthcare providers like CPMC, Sutter, and others that are experiencing significant market pressures to consolidate their services to continue to serve our neighborhoods. And that means fighting to keep St. Luke's open and fighting to keep services being provided at places like Davies.
All right. Next question.